Hello class, welcome to HIV management. So in HIV management, we are going to look at a number of things. We are going to talk about basics of HIV and AIDS. We are going to talk about the treatment. We will look at the opportunistic infections. We will look at ARVs, their side effects, and many more things before the end of this course. But today we are starting with session 1. Session 1 is about the basics of HIV and AIDS. Purpose of this course or topic today is to provide basic information about HIV and AIDS, including causes, transmission, progression, knowledge and challenges. Learning objectives. By the end of this session, learners, you should be able to know basic facts about the impact, trends, definition, and causes of HIV. You should be able to understand the facts that affect the risk of transmission and vulnerability to HIV infection. We should be able to discuss strategies to prevent and treat HIV, AIDS, and care for people with living with HIV. We should also to be able to describe the challenges of managing HIV and AIDS. So this is the session outline as it indicates here, which we are going to be following. What is HIV? HIV, H stands for human, I stands for immunodeficiency, V stands for virus. Many people make a mistake. They like saying I means immuno or immune system. I stands for immunodeficiency. Immunodeficiency. So when you look at deficiency, it means suppression, meaning the deficit. Deficit is lacking. So immunodeficiency simply means the lack of immune system. So HIV is a viral infection, as indicates here. It's a viral infection that affects human. It is characterized by the immunodeficiency, meaning it attacks the immune system and destroys the immune system. The same HIV is what is responsible for causing AIDS. So AIDS is a disease, but HIV is a virus. So that's the difference. The virus is what causes AIDS. For example, a mosquito is the major cause of malaria. Which type of a mosquito? Female Anopheles mosquito is what causes malaria when it bites when it bites a person. So similar when HIV is injected into a human being, it progresses and causes AIDS. What is AIDS? A stands for acquired, I stands for immuno, D stands for deficiency, S syndrome. So you can see here, like I said, that many people make a mistake. It is indicating that it's immuno. I here stands for immuno, while D stands for deficiency. But on AIDS, it is just one I, which stands for immunodeficiency as one. But on AIDS, I stands for immuno, separate. D stands for deficiency. So this acquired means for HIV to enter someone, This is not a genetic disease. No, it's not a genetic disease. It is acquired, meaning it is contracted from somewhere. So if anyone has HIV, any of your patients, just know that they acquired it from somewhere, of which, as the session goes, we are going to learn how it is acquired or how it comes about. Immunodeficiency, meaning that it goes to attack and suppress the immune system. The syndrome means that it lives in the immune system and it lives in the blood or in the human body and destroys the immune system, meaning when you have it, you stay with it. It's a permanent lifetime disease. It is characterized by signs and symptoms of severe immune deficiency, meaning that when one has AIDS, the immune system is severely reduced. Severe means critically reduced. So if someone, if the immune system is not critically reduced, meaning that if the immune system is not critically reduced, it simply means that someone will still remain with HIV. But once the immune system becomes critically reduced, if it reduces critically, then it will upgrade to AIDS. So some signs and symptoms are like as follows: weight loss of more than 10% of body weight. So a person with AIDS, they tend to lose weight, 10% of their weight quickly. If a person was weighing 80 kgs, you find within a short time they will reduce to 70 kgs. Again, within a short time, they will reduce another 10. It goes just like that. Then they also tend to have diarrhea lasting longer than 1 month. They have recurring diarrhea. Then they tend to have fever lasting longer than 1 month again, because they become prone to infection. They catch infection easily. And there are also other signs and symptoms that appear. Relevance to public health. As you know, HIV and AIDS is a public health concern, meaning that public health department is concerned about HIV and AIDS, is concerned, meaning everyone must be involved or is involved, direct or indirect, in the fight of HIV and AIDS. First, it was recognized in 1981. That is when AIDS was recognized. That's when it was discovered, in short, in 1981. For your own information, the one who discovered it was Dr. Chileshe, may so rest in peace, was a Zambian, together with some doctors from Uganda. So the research was done in Zambia and Uganda. When it was discovered after by Dr. Chileshe and the group, that is why we were able to be awarded to have what is called the Center of Excellence at UTH. At UTH, there is what is called the Center of Excellence. Immediately when you enter on the other side of near the pediatric wards, you will find a building that is specialized on HIV. That is called Center of Excellence. That's where the major research about HIV is still conducted. We were awarded because of the research that Dr. Chileshe and the team conducted. One of the largest epidemics of the 20th century. So when you talk about epidemics, you are talking about the disease progression. You are talking about the disease progression. So we have this epidemic, which is a public concern. So it's more like an outbreak, but it's not an outbreak really, because an outbreak mostly deals with it deals with the non-communicable diseases, but it also came as an outbreak in the 20th century. Approximately 33 million people living with HIV by the end of 2007. So by the end of 2007, we recorded 33 million. 2.7 million people infected with HIV. So those who are living with are the ones that are 33. Living with, meaning those who were tested positive. But those who just contracted newly, like becoming infected, were 2.7 million. So when you add 2.7 million and 33 million, then you will see how it progresses, because 2.7 million people becomes infected nearly almost every year. Global summary of HIV by December 2007. Number of people with HIV total 33.2 million, adults 30.8 million, women 15.4 million, children under 15 years 2.5 million. New infections in 2007, adults 2.2 million, children 370,000. AIDS death recorded, people who died by 2007, total 2 million. Adults 1.7 million and children 330,000. So these they continue and like this death is recorded nearly each and every time. It's recorded each and every time. So even now, as we go on, we will look at now how it is affecting us, because this is just a background of HIV and AIDS. So adults and children with HIV in Zambia, rather in 2007. So you can see how the globe is affected. When you look at somewhere in North America, there is 1.3 million people coming down between North America and South America at the Caribbean area. We have 230,000 people. When you come to check in Europe, we have 760,000 people infected. Then when you cross going into Asia, somewhere North Asia, like Eastern Europe and Central Asia, recorded 1.6 million. East Asia 800,000, and coming to South and Southeast Asia, we recorded 4 million. When you look at the Oceania recorded 75 million. When you come to check in Africa, Middle East and North Africa records 380 million. And when you check in countries that belong to Sub-Saharan Africa, they record 22.5 million. So Sub-Saharan Africa records the highest infection. It records the highest infection when you check how the statistic is telling us. So Sub-Saharan Africa, this involves countries such as Zambia, Namibia, Angola, Mozambique, and Botswana. These are the countries that are found on Sub-Saharan region. So that is why Zambia is called the HIV and AIDS country, referred to, because not because of discrimination, no, but it simply means that it's a country where the highest HIV rate records: Zambia, Angola, Mozambique, Botswana. And the center is Zambia, because that is where people are able to easily access treatment, and that's where people are able to access testing easily. And HIV services are conducted free and fairly, like in Zambia, other than in these other neighboring countries, meaning we are better stable than our fellow countries, our neighboring countries. But together, we record the highest in the world. That is, by 2007, we recorded 22.5 million. As we go on, by the end of this program, we'll be able to know how we are today, how the rate is by today. You can see in terms of percentage with HIV, for a percentage of adults with HIV who are women between 1990 and 2007. So between 1990 and 2007, that is when HIV came to be known. That is when most of these policies came about in terms of free HIV testing, mandatory testing, and so forth. Before 1990, people were dying with HIV without knowing the major cause. And not until the research was undertaken after that, then policies were set across. That's where when we even started using the Determine tester, so that people can easily know their HIV status. That's when mandatory testing to women on antenatal also started. So a lot of activities were commenced and a lot of funding were funded so that together HIV can be combated. So you can see in terms of percentage, Sub-Saharan Africa is still leading. And when you check Latin America, it's almost middle but low. And when you also check European countries, Central Asia and European and East Europe and the Central Asia is still low. Why? Because East Europe and the Central Asia, these countries are too cold that side. They are too cold. And this is when they have become populated, because by then they were not much populated. But nevertheless, it's because of the coldness. Someone will still ask me to say, does it mean HIV does not survive in cold? The answer is, when it is in the cold regions, almost all bacteria, they are not too active. But with HIV, it infects. So anyone who is HIV positive, whether in cold or not, it is still a risk factor. Still a risk factor. But because people in the cold lives in isolation, they live distant, they live in distant homes. That's what caused them not to much infect each other. When you compare to Sub-Sahara, most people are poor. So people who are in lower class, they are more prone to HIV and AIDS because they live too much closer. They live together so much. That's why they are so much prone to the infection or disease, because they are too much crowded. There are so many shanty compounds and so forth. So when you look at the sexual behavior, is more high because people are living in the same area so much. You exchange the same women, the same men, and so forth. So you tend to infect each other at a faster rate. Effects of the virus. The virus attacks white blood cells that fight infection in healthy people. So the major target of the virus is to go and attack white blood cells, especially those that fight infection in healthy people. It also changes the composition of white blood cells and enables HIV to replicate itself. So the way white blood cell is formed in a way that it's able to fight diseases. But when a white blood cell is infected, it changes its shape. So when it changes its shape, HIV takes over that cell. Instead of protecting from diseases, it starts replicating and starts killing other white blood cells so that the number of white blood cells can reduce. Replication means to increase, to multiply by making another copy. It also weakens the immune system. It increases vulnerability to life-threatening illnesses. So HIV increases chances of one being infected by most dangerous illnesses like TB, sexual transmitted diseases, especially those that takes advantage because of the lowered immune system. So as we go on, you learn about this, and they are called opportunistic infections. The main routes of HIV transmission, we have number one, sexual. Main mode of transmission. It accounts for 70 to 80% of all HIV infections. So here the fact is that 70 to 80% of people who are HIV positive, it was contracted sexually. I know as clients comes to you, they will tell you different stories. Yes, hear them as according to profession. Hear them, be non-judgmental, and do not discriminate. But you should know that the majority became infected through sexual activities. It is only difficult to control sexual activities, because if I became the president, I was going to ban sexual activities. I was going to say, okay, even those in marriages or whatever, to be quarantined at least for 3 to 5 years, no sexual activity. Then there, the rate of HIV can reduce, because we cannot record new infections. But it is difficult, meaning that as much as sexual activity is high, people will still be becoming infected. Then the other one is parenteral. Parenteral, this is parenteral. It simply means being injected, being put in. So number one is blood transfusion. So when there is blood transfusion being performed, blood transfusion is when you are putting blood into a patient from another person. If that blood is infected with HIV, then definitely even the person you are putting in blood will become HIV positive. And also, there is when someone has been injured and you become direct in contact with that blood. If that blood is positive, then you will also contract the virus. And it goes like that, meaning there should be an exchange in terms of blood. Then also contaminated needle pricks. There is when you prick yourself with a needle or any other sharp instrument. If the sharp instrument has pricked or injured someone who is HIV positive, then you are also at higher risk of becoming HIV positive. Also sharing needles. If one is you are sharing with is positive, then you also have a higher chance. Then vertical. Vertical is perinatal. In utero, during labor, utero means the uterus. Perinatal means from mother to child. During labor and delivery. And through breastfeeding. So one can become HIV positive through, especially children, babies and born, they can become positive through the breast milk of the mother who is infected, or during birth, not when they are in the stomach. No, when they are still in the pregnancy, there is no contact, there is no blood contact between the mother and the child. There is no blood contact. I hear a lot of stories like, no, the blood of the mother, they share the same blood with the child. No, there is never such. There is a difference. Each one, they have their own blood. There is no contact between the mother and the baby. It is different. So a child can only become infected when or during labor. If the child has been injured, definitely the mother will lose blood during labor because there are some lacerations that takes place. The tissues becomes teared, like the placental tissues, they tear, the vaginal tissues, they tear. So if the child also has any laceration, any open wound or cut, and there will be that blood contact, which puts the child at higher risk of becoming HIV positive. Physical factors affecting transmission and vulnerability. So these are physical things that are visible, things that we are able to see. So there is the viral like strain of HIV. So the type of HIV. So there are types of HIV. As we go on, we are going to look at them. So they also matter. For example, there's type 1 and type 2. One can be contracted with type 1 or type 2 or both. So those who have both, even the illness becomes too severe. But if you have one, you are better. Then even the viral load. So if the viral load is high, the viral load is simply the number of viruses, HIV viruses in the blood. So if the number of HIV viruses in the blood is high, meaning you can infect a lot of people, or one can infect a lot of people, and even yourself, you are at risk because the higher viral load reduces the immune system. Then to the host, presence of sexual transmitted infections. So if you have other infections like STIs, syphilis, gonorrhea, and so forth, meaning you have higher chances of becoming or contracting HIV. Stage of infection. So if we look at the stages of infection, I know you already know these stages of infection because during your certificate, you did these stages. So when you are at asymptomatic, at asymptomatic stage, yes, we'll talk about all the stages again here. And I know it will be a little bit different because here we are trying to go deeper than it was in the certificate. So during asymptomatic stage, one does not show any sign, any symptom. 80% of them, they don't even know they are HIV positive. That is the time the spread is highly spread to other people because of the stage of the information. That's when people give anyhow. Also circumcision. Circumcision provides the 60% of prevention. Why? Because the forehead skin has some target cells. So when you remove the forehead skin, you have simply removed the target cells from that easily catches HIV. And also the forehead skin harbors too much infection, which also harbors the HIV virus, and be able to keep it because it is warm, and all bacteria and viruses want to live in a warm environment. Also hereditary resistance to HIV. So hereditary, we are talking about genetics. There is a gene that is resistant to HIV. I know each and every person mostly wishes to have that gene, but unfortunately, it is so difficult to find that gene because out of 1,000 people, you can only find one person or none who has such a gene. These people, they have their cells do not have pillars because pillars are what um, um, are the communication areas for any cell. So if you don't have a pili, if a cell does not have a pili, it cannot be infected by any illness or infection. They cannot. So there are some people who have this type of a cell that does not have pillars. Social and demographic factors in transmission and vulnerability. Social views toward women. So mostly men have a wrong perception towards women. Even people have a wrong perception towards women. Men think they can marry any woman, they can have sexual affair with any woman. That's how a man thinks. That's how a man thinks. Mostly, even men think that it's only women who can catch HIV. But meanwhile, it is not like that. It's not like that. Youth perceptions of sexual and risky behavior. A youth thinks that they need to train sexual activities before or in preparation for their marriage. So they have a long chain of sexual partners, which puts them at risk. Demographic, meaning according to the data and research. Mobile and vulnerable populations influencing frequency of sexual partner change. So when you look at, there are people who do not have a specific sexual partner. They are mobile, like our friends, the prostitutes. They are mobile. So when they are mobile, you know that they are able to give sex to anyone as long as it's in exchange of money, which actually influences so much the frequency of sexual partners, because anyone who feels like having a sexual partner or to change a sexual partner can easily go, you pay this one, you have sexual intercourse, also you leave them, you go to another person, just like that. And the vulnerability, mostly people who give in, especially young, the youths, the ladies, who give themselves to men because they want support. Probably they are being supported in one or the other way. And because of this, sugar daddy is helping them at school, is helping them to buy talk time, clothes, lotion, and so forth. They become vulnerable to sexual partners, and this becomes an attitude that they can have more than one sexual partner. Established presence of HIV in the community. If a community has high infection rate, meaning a lot of people will become infected. I'll give an example in Zambia. Lusaka records the highest HIV rate, but it's not Lusaka district, no. Specifically, Rufunza district records the highest because there is so much a presence of HIV in the community in Rufunza. People have gathered themselves, or they live so closer to each other. And if a number of people are HIV positive in that specific area or geographical area, meaning that even those that are growing up will easily catch it. Some will born with it or will contract it through mother to child. Some will get it because of the point on top, which is vulnerability to populations. You don't have any man to marry you. The only close man who can marry you is HIV positive. And what did you do? Many, they tend to say, okay, I understand this man, you just marry me for the sake of love. You become also HIV positive. And another community, Rufunsa is a district, but when we want to check on just a community, not a district, but a community, Linda compound is the highest. Linda compound is the highest because of the nature of livelihood that is in Linda compound, which follows by Kuku compound. Kuku community or compound is the second highest. So these records the highest. In terms of recording or registration, Kanyama Health Center records the highest number of people who are HIV positive on treatment because of Soweto market. Every marketeer, or rather 80% of marketeers at Soweto, they register themselves to Kanyama Health Center or first level hospital because it's the nearest. When they are selling, they'll be able to go and collect their drugs and so forth. So when you go to Soweto, you find that if the large population is HIV infected, then even those who tend to become marketeers, they are at a higher risk. Once they indulge into sexual activities, they are able to contract it easily. Phases of HIV infection. So HIV is also in phases, like we said, which are also called the stages. There is first, which is called the acute stage. The acute stage is when you have just contracted it. HIV replicates quickly, meaning it multiplies quickly. Within 3 to 6 months, HIV should multiply. This is at the acute stage, meaning at the beginning of it. Also, energy requirements increase, meaning as a human being, you need more energy because HIV is using most of the energy that you have. This is what causes a lot of people to become sick during this period. They'll just have maybe a fever, or they'll just have any simple illness. Probably they may not even know why. Some of them, or most of them, they feel sort of lazy in doing work. They feel not much to do, not to do so much work, and so forth, because the HIV virus is using so much energy, which they consumed through food, for it to quickly multiply or replicate. The second stage is asymptomatic. At this stage, at asymptomatic stage, no sign. You cannot identify a person how they look to be positive, no, because there is no any sign, no symptom that will show this for them to be positive, including themselves. 90% of them, they don't know. It's not until they just do a VCT, a voluntary counseling and testing, that's when they can know. At this stage, many people, they even reject, they refuse to be positive. At this stage, they are difficult. Even to test, they are difficult because they don't suspect themselves to have any illness. The third stage is called symptomatic. So asymptomatic, meaning that no symptom. When you remove A, it becomes symptomatic. So when it is symptomatic, there is onset of opportunistic infections. Opportunistic infections these are infections that takes advantage because of the lowered immune system. By this time, the immune system is lowering. So the person will start catching infections easily. Persistent headache, persistent diarrhea, and so on and so forth. Further increase in nutritional requirements. By this time, a human being needs a lot of food because for you to be able to support the immune system, you need to have eaten enough and nutritious. I know it's difficult to have a balanced diet like here in Zambia, but it's easy to have a nutritious diet, meaning a diet that is going to help you to have energy and also to grow healthier. At this stage, that is when it is mostly required. Late symptomatic. So this late symptomatic is also known as full-blown AIDS. So symptomatic stage can take 10 years. One is at symptomatic. But the moment immune system reduces, it becomes the last symptomatic, which is called the full-blown AIDS. By then, HIV has graduated into AIDS. So at this stage, you have a heightened viral load, meaning you have a very high viral load. The number of viruses in the blood is too high. Also, secondly, you have intense weight loss and wasting. So you tend to lose weight and you tend to lose weight. I mean, you tend to become slim. You become slim. You also have higher risks of opportunistic infections or the presence of opportunistic infections taking control. This is when people mostly they present with tuberculosis and other diseases, and they take control of the person, because you find that the TB will be relapsing just like that. HIV recognition and testing. This may be negative during first 3 months after infection, which is also called window period. 2 tests required plus a third to confirm if results conflict. So sometimes if the results are conflicting, you know about the indeterminate. So meaning you need to do furthermore 2 to 3 tests to be able to confirm. So you cannot confirm someone to be HIV positive just on a single test. You need to use the determine. After that, you are going to use the UNIGOT. If at all they conflict, then you have to retest again or use a tiebreaker. Repeated test recommended 3 months after initial test. So when someone comes for the first time, they are tested negative, ask them to come again after 3 months for another test to repeat. False positives, very possible in children under 18 months old. So mostly false positives, meaning that when you test a child who is under 18 months, sometimes the results may become positive, but not necessarily that the child is positive. Meaning you need to continue testing the child, not until you confirm. You have to be very sure that the child you have tested is truly positive before initiating them on drugs. We'll learn more when we talk about drugs. Types of tests. So we have blood tests for antibodies against HIV. Most common enzymes, immune assay enzyme, linked immunosorbent assay, which is also known as ELISA. So when during the exam, when a question comes, ELISA stands for what ELISA stands for. This is what ELISA stands for. You need not just to read ELISA, but you need to know what it really stands for. So this is a type of a test. It actually tests the actual enzyme for HIV. Then we also have gold standard. Gold standard, which is also known as Western blot, more especially than, more specific than ELISA. So this one is actually better than ELISA and used as a confirmatory test. This is what we mostly refer to as UNGOD. Then also radio immunobinding assay. So this one is expensive and used as a confirmatory test when antibodies are low. So when you test someone using DeterMine, it comes out negative. Positive. You use UNGOD, it comes out negative. You have a tiebreaker. You retest again, it still comes indeterminate. You retest the third one, it becomes indeterminate. That's when you come to use the radioimmunobinding assay. Then you also have a dot blot. So dot blot immunobinding assay are cost-effective, rapid screening blood test. So this dot blot is what you use as DeterMine. Read on the DeterMine, you will see the dot blot written there. This is a rapid test. The results becomes ready 3 to 5 minutes. Then we have a polymerase chain reaction, PCR. So this one measures HIV genetic information. This is where you usually know if it is HIV1, HIV2 using the PCR. So please make sure you know these tests, because when you go and work in the lab, you are going to use this, or you must use all these tests. If you can't use all, at least a number of them, you should be able to use them. So we continue. We also have urine tests. Tests for antibodies in urine. You are able to test for HIV antibodies in urine. Also are not as sensitive as blood test. So it's a little different when you use urine to test with blood. Urine is not as much sensitive. Then enzyme immune assay, which is EIA, it's also another test. Then you can also use the Western blot. Then in the oral fluid test, here you test for antibodies on oral fluids. So this is where we use the self-tester. There's that self-test kit. You test for antibodies in oral fluid. You can also use the enzyme immune assay, which is EIA, and the Western blot. But for you to use the Western blot and so forth, you need a lot of sample. You need a lot of saliva, which is not much possible to use just little saliva that you have or that you are able to spit, because you need a lot of it. But the first one, which is the test for antibodies in oral fluids, this one is just a direct one because it's a self-test kit. Treatment of HIV and AIDS. First of all, one thing you have to know is that in HIV there is no cure. In AIDS there is no cure. It's zero convention. Once you have it, it goes like that. HIV and AIDS has no cure. But you cannot tell your patient that HIV has no cure, because your patient may take it personal. They may take it personal. So probably you are experts. You know how to talk to your clients. But you should know that it has no cure. Treatment can help slow progression to to AIDS. So treatment only helps to the progress of AIDS to be very slow. It reduces opportunistic infections. OIS means opportunistic infections. So in a lot of notes, we are going to be using abbreviations. You need to know these abbreviations, especially when we talk about them. So it reduces opportunistic infections and minimizes malnutrition, because as we said, when HIV is multiplying or replicating, it needs more energy, which causes malnutrition in a patient. But if one is on treatment, then it will minimize the malnutrition. The patient will not be prone to malnutrition. The most effective treatment is antiretroviral therapy, which is ART. Antiretroviral therapy. Many of you like saying antiretroviral treatment. No, it is a therapy using antiretroviral drugs, ARVs. So antiretroviral therapy and antiretroviral drugs. So the treatment is antiretroviral therapy. Then the drugs that are used are antiretroviral drugs. So the ART, which is antiretroviral therapy, combination of, this is a combination of ARVs, because ARVs are in so many types, and definitely we'll talk about them. Proven to limit replication of HIV in the body. So when one is taking ARVs, it reduces how HIV replicates or multiplies in the body. It reduces, meaning the viral load also reduces. It delays onset of AIDS and prevent additional opportunistic infections. Challenges. ARVs are expensive. In Zambia, or rather in Africa, Zambia is one of about 3-4 countries where ARVs are free. And Zambia is the only country in the world that have 100% free and effective ARVs, because we don't run out of ARVs, but they are expensive to buy. Must be taken for the rest of the person's life. So if you initiate someone on ARVs, counsel them properly and make sure you make them understand, because they have to take these drugs for the rest of the patient's life or client's life. They also have uncomfortable side effects. So patients will complain to you, but doctor, in an so I feel like this, like that. Yeah, don't take it light. It is uncomfortable. So feel for them as well. I know sometimes you may not change the type of drug they are using just there and then, but you have to feel for them, because the side effects are not comfortable, especially when they start. A lot of people hallucinate. They start seeing visions, they have nightmares. So it's not easy. It's not easy. All you need is to sympathize with them. Demographic impact of HIV and AIDS. In the West, affected countries, HIV has reduced life expectancy by over 20 years. So in most countries where HIV is so prone, like in sub-Saharan Africa, when you follow in old days, our grandmothers used to grow older, more than 100 years. But this time, it is 60 years. That's life expectancy. Life expectancy in Zambia is 60 to 80 years, meaning about 20 years has been reduced from 100 plus to somewhere 80 years. Someone who is 80 years by now, we even clap our hands. Bakura. Why? Because the life expectancy of people have reduced because of a number of people living with HIV/AIDS. So when you have HIV/AIDS, or if a patient has HIV/AIDS, expect the number of years they are expected to live to reduce by approximate of 20 years. If they are supposed to live 80 years, expect them by 60, 70 years to die. I know it's painful, and you cannot tell a patient to say maybe by this time you will die. It's painful, but that is the reality. That is the reality. That's why they have to take drugs more serious. Because if a patient takes drugs more serious, they can live as long as possible, because the number of HIV will fully reduce. Some people reaches a point of no any HIV detected in the body. When they reach such is a point, meaning the whole HIV is sleeping, it becomes non-infectious, and they are able to live a very good normal life. But as long as there is a number of viruses detecting, then definitely um, um, there should not be expected to live the actual expected life expectant age. In Southern Africa, life expectancy has dropped below 50 years. When you look at Southern Africa, Zambia is part of the Southern Africa, and some countries I mentioned are part of the Southern Africa. Those in Sub-Sahara are part of Southern Africa. They are part, as long as they participate to COSAFA Cup, meaning they are part of Southern Africa. So that's it. In the West affected countries, HIV causes over 1/3 of child deaths. It's rare that children just die with pneumonia and other things. Most of the children, they die as a result of HIV, especially if it is not early detected in the mother, so that it can be prevented from mother to child. In the 7 countries hardest hit by HIV, under 5 mortality has increased by 36%. So when you look at the 7 countries, I think I mentioned that Zambia is among the 7 countries. So this is just a geographical map, regional in terms of life expectancy between 1950 to 2010. Child deaths from AIDS from 1990 to 2010. So this is how the deaths have been happening. So you can see that somewhere in 2004, 2003 it was the highest. 2007 it reduces a bit. Impact of HIV on food security. It decreases availability of food. So HIV is not favorable when it comes to food security because of failing production. If a lot of people are HIV positive, even the number of work or the percentage of work reduces. If they were working, they were able to farm a big farm or land, but because of the illness, definitely they will reduce the portion. Also loss of family labor, land, livestock, and other assets, because they will not be able to work as they can work when they are just infectious free. Also decreased access to food, low income. A lot of people who tend to be HIV positive, in old days, they were being stopped from working. It's now that we have HIV policy, which allows each and every person who is HIV positive to work in any company just like any other person. But nevertheless, there is low income in a number of them. Impact of HIV on the healthy sector. It strains of already major healthy budgets. So HIV consumes about 10% US dollars of the budget. Like I said earlier, to say HIV, I mean ARVs are expensive. So for HIV to be able to be sustained, 10% automatically is allocated to HIV programs. Then there's heavy demands on healthy system, such as increased need for medical supervision, longer hospital stays. If one is admitted in the hospital, those with HIV positive, they live longer than the others. Health workers shortage and burnout is also another factor. Impact of HIV on education sector. Declining school enrollment. A lot of HIV people, especially in the rural areas, they decline school. Then also illness and death of teachers. A lot of teachers died or they die as a result of HIV illness. Also increased the cost of training new teachers to replace those lost because of AIDS. Comprehensive package of HIV and AIDS programs. Prevention programs are a must, such as health and sexual education, expansion of behavior change and harm reduction strategies, increased access to VCT and PMTCT, which is parental mother to child um, treatment. So these prevention activities, they are expensive because even you'll be going to conduct some prevention activities. Definitely when you get employed, you'll be working in one of those areas. Then also treatment, secure access to ARVs for people living with HIV AIDS. Like I said earlier, that ARVs are expensive. Also the treatment of opportunistic infections. These people will not come to the hospital without being treated. They will come and they have to be treated. Proper nutrition is also required. Comprehensive package of HIV and AIDS programs. Care and support, like signage and with prevention interventions, healthy services, psychosocial support, management of ARVs side effects. Also, we look at mitigation of social and economical impact, like mitigation, simply the prevention or or trying to look after the effect. When something has happened, you mitigate. Before something happens, you mitigate. So this is the care of the orphans, vulnerable children, those left because of parents who died as a result of HIV. Then also access to basic needs, rights, and general well-being. So like the strategies that have to be undertaken to prevent and control under nutrition, you can see there, improve household food security, improve diversity of diet, improve maternal nutrition and healthy care, improve child feeding practices, ensure child health care, which is immunization, medical care, growth and monitoring, provide nutritional rehabilitation. So the challenges which are there, generally, in terms of responding to HIV is political commitment. So there is need of political commitment to HIV, meaning those who make our laws are politicians mainly. So each political ambition has an impact or has a challenge to HIV. Then also funding. Funding is a major challenge because for us or for you to be able to meet the need, meaning you need a lot of funding. Then human resource in healthy system. Human resource simply means the workmanship is low. So once you are trained, most of you have higher chances, especially those of you who are just from the hospital, you know how much need it is. Some of you, you are even retained to be volunteering because there is so much shortage in terms of human resource. Discrimination against people living with HIV/AIDS. Scale and quality of interventions. Lack of vaccine, because HIV does not have a vaccine. A vaccine was introduced, but it was not approved yet. But in some countries like South Africa, it has been approved. But in Zambia, in some countries within Sub-Sahara, it's not approved. In conclusion, HIV attacks and weakens the immune system, reducing its ability to fight infections. Many transmission routes are sexual, parental, and vertical. 4 phases of HIV disease are acute, asymptomatic, and full-blown AIDS. HIV is recognized mainly by testing antibodies formed to fight the virus. ART can prevent opportunistic infections and slow progression of AIDS. A comprehensive package of AIDS and HIV and AIDS interventions should include infection prevention, ART, care and support, and mitigation of impact of HIV on food security, health, and